Good afternoon, and thank you for joining us for the June 2nd COVID-19 virtual news conference. My name is Mariah Miracle, and I'm a public information officer working in the Joint Information Center. We'll start by introducing this week's panelists. EOC Operations Chief Sofia Pereira, Public Health Director Michele Stevens, and County Health Officer Dr. Ian Hoffman. I'll start today with a brief overview from the Joint Information Center. A total of 4,323 Humboldt County residents have tested positive for COVID-19. That's an increase of 70 cases over the last week. The county has also reported 7 additional hospitalizations in the last week for a cumulative total of 190 hospitalizations since the beginning of the pandemic. And 43 members of our community have died with COVID-19 since the county's first case was diagnosed in February of last year. No additional deaths have been reported since last Wednesday. CDPH updated tier assignments under the Blueprint for a Safer Economy yesterday, and of California's 58 counties, Humboldt had the second highest positivity rate at 5.6% and the third highest case rate at 7.9 cases per 100,000 residents. Vaccination data for 12 to 15-year-olds has been added to the data dashboard since last Wednesday's news conference, and this is the most recent age group eligible to become eligible for vaccination. All county residents are encouraged to bring the whole family to get vaccinated at a public health vaccination clinic for this Saturday at Eureka High School from 11 in the morning to 3 in the afternoon. Anyone over the age of 12 can receive the Pfizer vaccine at this clinic, and those aged 18 and older can also choose the Johnson & Johnson vaccine. Walk-ins are available at this clinic, but signing up in advance is a good way to make sure that a dose is available, and you can do so at myturn.ca.gov. The Joint Information Center is also ready to answer COVID-related questions from county residents in English and Spanish, so give us a call at 707-441-5000. Now we'll hear from our panelists who will share an update on what they've been working on before taking questions. Let's start with EOC Ops Chief Sofia Pereira.
Well, good afternoon, everyone. I'm going to share some highlights from our vaccination effort here in Humboldt County. We are officially done utilizing the Arcata Community Center for mass vaccination clinics. We did finish up a second dose clinic there last week. And so we're just really grateful for that partnership and getting lots of folks vaccinated at that site. Last week, we did hold our second Pfizer first dose clinic that includes that 12 to 15-year-old population. And we do have another one today from 2 to 6 at CR. And we do have walk-ins are welcome. So if you're watching this and happen to get the news before 6 o'clock, please come on down to CR. And hopefully we can get you a shot. We will continue to host the second dose Pfizer clinics at CR throughout June. So we will still have a presence there throughout this month, wrapping up second doses there. And like Mariah mentioned, this Saturday, we will be at Eureka High from 11 a.m. to 3 p.m. Appointments are still available, so please sign up, or walk-ins are welcome as well. And we are continuing for our mobile outreach, reaching out to local schools and community partners to provide vaccine in various communities throughout the county. And so we'll share more details as some of those dates are finalized. And I think it is really important to note, given the vaccine supply that we have on hand for the month of June, we are planning to have Johnson & Johnson at every clinic that we are hosting. So you will see this in My Turn if you go to sign up for a clinic. If it's a Pfizer clinic, you'll see there's an option to also sign up for Johnson & Johnson. But we just want to make this vaccine as accessible as possible. So even if it's a second dose Pfizer clinic, if you want to stop by, we should have some Johnson & Johnson on hand to meet that need. So overall, if you want more information about our clinics, you can sign up online at myturn.ca.gov. And if you ever need assistance in finding a clinic or getting registered, you can also call the Joint Information Center at 441-5000. Thanks.
Thanks, Sofia. Michele?
Sure. I was just going to actually piggyback a little bit on the vaccine front and talk a little bit about our approach using an equity lens to vaccine. We've talked about this in news releases and press conferences before, but I think it's a good update for now as we're moving into more mobile vaccination. You might remember that the state's framework had that sector-based tiers, and while that was important, it wasn't getting the hardest hit communities and populations across the state in order to decrease cases, hospitalizations, and deaths of COVID-19. So the state turned to the Healthy Places Index. It's developed by the Public Health Alliance of Southern California. It uses social, economic, and environmental data that impact health to compare community conditions across the state. So social determinants of health like housing, education, economics, access to healthcare, et cetera. And if you look at the lowest quartile zip codes across the state, those census tracts, that those are the least healthy, those have the least healthy community conditions in those areas. I think it's helpful to go to that website. It's healthyplacesindex.org if you've never checked it out. That's what we were using across the state when we pivoted from that sector-based tiers to targeting the communities most hardest hit by COVID-19. Because we really needed to impact what the data was looking like and how people were being affected by COVID-19 and where we were seeing severe disease and death. So here in Humboldt, we're using that data as well still, while we start to plan for more mobile vaccine outreach and decrease our fixed site model or our brick and mortar mass vaccination model. What it's going to look like is we're going to be going to various communities using that data to see what the vaccine uptake is. Arguably, in rural communities, access to transportation is the biggest barrier. And so we want to bring vaccine to people as much as we possibly can. And so that's what we're going to be doing more of. And into the future, as we continue to move through this response, vaccinating people for COVID-19 is just going to be the way that it is, just like flu vaccine and all the other vaccines that we do for kids and adults, right? So I think that's what we're going to start seeing more of, is us going out to communities that have been hardest hit or have the lowest number of vaccines taken or given to community members. And then we'll be at various events in the county, things like auto shows, crab games, farmers markets, public health, and the local healthcare providers will continue to provide vaccine as we keep moving through. And that's what we can expect. That's what we're planning for in public health as well.
Thanks, Michele. Dr. Hoffman.
Thanks, Mariah. Thanks, Sofia and Michele. I wanted to talk today about incentives and how we can hopefully get to those goals that we want to get to for vaccination for our county. And Mariah mentioned the case counts and what we're seeing, and I think that I've mentioned this. As long as we have an unvaccinated population here, we're going to continue to see cases, and so it's really our effort right now at public health in Humboldt County and statewide is to get as many people vaccinated as possible ahead of the reopenings that are going to start to happen on June 15th. And we're on a good path. So far, we have over 70,000 folks who are partially, at least one shot in Humboldt County, which is a really great effort. But we really want to get more. We need that's about 60% of the eligible population. So to get upwards of 75%, we have a ways to go. So what are some of the barriers? We've talked about barriers and how we want to overcome them. So we're going to do the mobile vaccination. The state's working towards getting more and more providers who can just provide the vaccine in their offices. So, primary care, pediatric offices having the vaccine. So when you come in for a checkup or for a well child visit, you can just get your vaccine at that visit rather than having to go have a separate visit to a public health clinic or to a pharmacy. But in the meantime, those are the ways that we have. So I want to encourage people to get out there, utilize those appointments. We know that our public health appointments, many available. If those don't work for you, go to vaccines.gov, look for a clinic in a pharmacy. There are, now programs through the federal government along with vaccines.gov looking for ways to try to offer transportation for people if that's a barrier. So encouraging people to look at that program through vaccines.gov if transportation is an issue, as well as my turn also offering transportation, to try to overcome the transportation barriers that exist for people So you can sign up for assistance with transportation, or if you are homebound, you can get on that homebound list, which we're getting and now looking at weekly from CDPH and working to get those folks vaccinations in their homes. So so those, we know those are some of the barriers. We're going to do other things like looking to go out to businesses, to events like Sofia and Michele mentioned. We want to make it as easy as possible, but those are long-term plans. So we have 2 weeks until June 15th. And I think the really big incentives that are out there right now that are also going to be aligned with June 15th are the ones that I want everyone to know about. Last week, CDPH announced the Vax for the Win campaign, over $115 million towards incentives for people who are either already vaccinated. So everyone who's vaccinated is included in this. So great news for you if you got your vaccine already. But also incentives for those who are not vaccinated yet. So for the next 2 million people who get vaccinated in the state of California, fully vaccinated, so either one shot of Johnson & Johnson or the 2 shots, completing the 2-shot series with Pfizer and Moderna. Everyone who does that, the next 2 million people will be eligible to get a $50 gift card from the state, and there's a bunch of information online if you want to see more about how that works. But that is, again, another way that we're trying to overcome those barriers, financial barriers. So if you have transportation issues, you need gas money, you need to cover the couple of hours you're going to take off of work to make this happen. This is there to help you and make it happen in the next couple of weeks. The other incentives are where there's a lot there for all those people who are, again, either already vaccinated or people who get vaccinated in the next couple of weeks. And for these other incentives, you only need to have one of the shots. You don't have to have both of them. And that is $50,000 prizes. They're going to be announced on Fridays for the next couple of weeks. And then on June 15th, there's going to be a grand prize drawing for $1.5 million for up to 10 people in the state of California who have at least one shot by June 15th. So, I hope we're hoping that is incentive to get people out there who are maybe on the fence and just putting this off to really get this done, because we think it's really important to get this done before June 15th, when a lot more reopening is going to happen, a lot less masking, no physical distancing, no capacity limits at businesses or in events or venues. So, prepare now. We want everyone to get a chance at that. And I really hope someone in Humboldt County wins one of these prizes. It would be a really great thing for the residents of Humboldt County. And the more people that get vaccinated before June 15th, the more likelihood that'll happen. So that's some of those barriers, financial barriers, transportation barriers. But I also want to talk about some other barriers that are out there. And we've been hearing a lot about concerns that people have, and want to address some of those concerns, the ones that we keep hearing over and over again. So the first one that I hear pretty often is that I already had COVID. I don't need the vaccine because I'm immune. And there is definitely some truth to that. And people who've had COVID-19, we know they mount an immune response. We know that response is measurable in the bloodstream, and we, currently our guidance says if you've had COVID-19, you don't need to worry about it getting it again for 90 days. You don't have to, quarantine if you're exposed again in that 90-day period. But we don't have a lot of data going further past that. And based on some of the studies of the original coronaviruses, SARS, there is some suspicion that is not going to last as long as vaccine immunity. And we pair that with data that shows that the vaccination causes levels of antibodies in the bloodstream that are 5 to 10 times higher And now some other data that shows that there is a longer term immunity with the vaccination. So, there's good reason, and we highly encourage people to get the vaccine, even if you've been infected with COVID-19, because the chances of getting something from the vaccine are extraordinarily low, and we cannot guarantee that if you don't get COVID again, that you won't have some sort of long-term effect, get a hospitalization, get severe complications. And so, which brings me to another one, which is that, well, why would I get the vaccine? It's worse than getting COVID. Again, I think that there's a lot of people out there who might feel that way. And certainly people have told stories. You might have heard stories from people. Yeah, man, I got the vaccine and it really knocked me out. However, I would say, let's go back to the data. And if we look at that data, we know that the vaccine has been way more effective at preventing severe hospitalization, severe disease, hospitalization, and death. And so I want to give you some of those numbers to put it into perspective. So what does a vaccine cause? It causes some pain in the arm. That's the majority of people. That's all they get. Some aches and pains in the arm. With COVID, we've had 4,000 people in our county get COVID, and we've had over 190 now have been hospitalized, and we've had over 40 people die. Out of those 70,000 people who've got a vaccine, none of them have been hospitalized from the vaccine, and none of them have died from the vaccine. And out of the very small handful who've gotten COVID after the vaccine, they've all been asymptomatic or very, very mild symptoms. So I think it's really safe to say that COVID is much worse than the vaccine. So I want to encourage people to get the vaccine and ahead of that June 15th deadline. Last couple of things, we hear a lot, the vaccine was rushed, it was made too fast. Again, unprecedented the amount of speed that this was done with. However, the science had been there for decades to support this. The vaccines, the two types of vaccines have been studied, some of them going back to the 1980s. We knew about SARS back in the early 2000s when we had the first SARS outbreak. So it wasn't like coronavirus was brand new, that SARS was brand new. So we had knowledge to build on to make this happen very quickly, which was great. And the last piece is just that, we hear quite a bit, I've heard that the vaccines can change your DNA, that they have weird stuff in them. And I want to let everyone know that while these are truly amazing vaccines, they are not so amazing that they can change your DNA. They do have RNA in them, which is a short-lived protein similar to DNA, but it does not act the same way as DNA. It's gone, and everything in this vaccine is gone from your body within really a few hours or a day at the most. There's salts, there's fats, and things that stabilize it, like sugars, but there's nothing else in there. It all goes away, and the only thing that's long lasting is the immunity to COVID. So again, want to encourage everyone with that information, get out there, get the vaccine. There's lots of opportunities. June 15th is coming. I hope someone wins that prize in Humboldt County, and thank you for listening today, and looking forward to questions. Thank you.
Thank you, Dr. Hoffman. All right, now we'll take questions from reporters, and we'll start with the Time Standard's Isabella Vanderheiden.
Great, thank you for taking my questions today. So last week, Dr. Hoffman had set the ambitious goal of getting 75% of Humboldt County residents vaccinated ahead of the June 15th reopening. So I guess first, what kind of progress has the county made in the last week? And also, can Dr. Hoffman clarify what vaccinated means in this sense? Is it one shot, is it 2 shots, or is it the fully vaccinated after 2 weeks?
Yeah, great question, Isabella. Thank you. So I think if we can get up to 75% of folks with at least 1 shot, that would be a tremendous place for us to be. If we look at other counties who are either near that, like around 70% with one shot, and again, we're talking the eligible population, since we certainly can't, that would be really high rates of the total population until we can open it up to the younger age group. So if we look at other counties who are at or above that 70% mark with of the eligible population with at least one shot, those are counties where case rates are really low, test positivity is really low, and they are reopening more rapidly. They're more confident. People have confidence in going out and being around other people in those places. So I think that, we won't know because these incentives were just launched in the last few days. So we haven't really had time to see the impact of them, but I'm hopeful that the incentives will get those last few folks out there who are on the fence to a vaccination site. And so I think the next couple of weeks will really tell us whether or not we can make that goal or not.
Thank you. And I do have a quick follow-up with that. So I noticed that the vaccine data hasn't been updated on the dashboard since May 24th. And that's, if you scroll down a little bit on the page, and it says about 48% of the population has received at least one shot, but Dr. Hoffman had just mentioned that the number is actually about 60%. So I'm wondering how often the dashboard is updated and how many people are actually fully vaccinated at this point.
Take it away, Dr. Hoffman.
Yeah, well, Mariah, if you want to also put in, so we update that once a week. And so today is the day, so it will be updated, I believe, Mariah, correct me if I'm wrong, later today. And the data that we're posting is data that we get from the state, which only includes the CARE data. So there's a couple of different data sets that vaccination records come from. So CARE is the California Immunization Registry. That data is missing some of our population that is vaccinated through a federal program, specifically the IHS, Indian Health Services. And so we have access to some of that data. And so when I talk about that 70,000 or 60%, that includes the CARE data plus IHS data that we have access to.
And just to add to that really quickly, Isabella, the local vaccination data that we pull is gathered on Monday, and it takes a few days to process it and break it down by demographics, and it's posted on Wednesday publicly.
All right, thank you for clearing that up.
Any additional follow-ups, Isabella?
No, not for now.
Great. Do any other reporters have questions on that topic?
Yes, I do. So on a related note, the vaccination percentage that Humboldt County would like to hit was 75%, as you stated. Over the past few weeks, at least according to the data on the DHHS website, it's been increasing by about 2% every week. Do we think that we'll be able to hit the 75% by the reopening on the 15th?
I think that it all comes down to how much we can get the word out about what this means. I mentioned last week that there are some surveys out there that suggest that 80% of Humboldt County was willing to get a vaccine. So we really want to break down those barriers and get that, get up to those kinds of numbers. I think knowing that deadline is coming there's been national data that shows that changes to, say, like the CDC guidance around masking seems to have encouraged some people to to go ahead and get vaccinated. There was an increase after that announcement by the CDC. So we're hoping that people, knowing that date's coming, knowing that there is this large incentive out there for them too to make that happen before June 15th. So we got to get the word out. I think time will tell. I'm hopeful. We have enough vaccination. We have enough vaccine in the county, and we have enough places for people to go. So it's really about getting the word out and getting people motivated to get in there to get their shot before June 15th.
I would just add, yes, by June 15th would be amazing. And that's what we're hoping for and aiming for. But really, we know that this is going to be an ongoing effort in terms of vaccinating more and more people and getting out to those communities so that transportation isn't a barrier. And, some communities have populations of 150 people. And, if 4 of those individuals haven't had access and don't have a way to get to one of the locations to get a vaccine and we can vaccinate them, that's 4 more people that needed it that can get it. So that's what we're going to do. So whether it's post, June 15th or not, we're going to do what we need to do to get it to people.
Thank you both. Any additional follow-up questions on that topic?
Yes, about that 20% that you mentioned, what is the plan to help that 20% of people who say that they're unwilling to get vaccinated? Is there anything that the Joint Information Center is working on that will, help either convince them or help them to get into a place where they're still safe to go out into the community?
Yeah, there's a lot of different reasons that people don't get vaccinated, and it's not just for the COVID vaccine, it's across the board. So, we're here to offer information. We want to listen and hear what people's concerns are. Again, we've been listening to those concerns, and so collecting those and sort of getting what are the most common things out there that are concerns. So that's, again, wanted to address those today, because I think those are sort of some of the remaining barriers for people. And we want to continue just to offer the vaccine, make it as easy as possible. So again, once it's in every doctor's office, once we can get out to some of these smaller communities that, on an ongoing basis, and get into schools in the fall, a lot of different opportunities. So, what makes up that 20% is not one thing. There's no one answer to all of that. We just have to keep answering questions, being open, listening, and offering opportunities to get vaccinated.
All right, Carlos Holguin from North Coast News.
Thank you. So I was wondering if you could expand about the incentives you were talking about when it comes to going to public areas like craps games, farmers markets. Is there a kind of like a guideline of how that's going to work? Would people have to make appointments ahead of time? Is this going to be drive-throughs? How exactly would these public event vaccine clinics work?
Sofia, can you start with that one?
Yeah, thanks for asking about that. So, we don't have anything set in stone for some of those, great examples that Michele shared of where we could be going throughout the county this summer. So I think more details will come as we finalize some of those details. But, we want to make the clinics as, easy and straightforward as possible. I don't imagine that some of these clinics at community events are going to be thousands of people in a single day. This is going to be, taking one of our mobile outreach vans, having a presence at a community event, and maybe smaller scale. So I think it'll be that type of model that you'll be seeing over the summer. And we'll make sure definitely to promote these as much as possible. We'll add them to My Turn. So definitely the public will know about these as the details get nailed down.
Great, thank you.
Yeah, just and to add a little bit to that, these are things that have been going on across the state. So there's models out there we're going to be following, more like a pop-up event where no need for appointments, whether or not appointments will be available potentially, but certainly walk-ins as well. We're having a lot of experience right now with adding walk-in clinics to every clinic. And then I think, other incentives, there's a lot of interest in community partnership out there with making these things happen. And so businesses, they want to offer incentives as well, because it's good for business for them to have more people vaccinated. It makes everyone feel more confident. It makes everybody want to get out there and get back to normal. So, they see that number now of the percent of vaccination is like, that's their consumer confidence. They want to get back that as high as possible. So a lot of businesses are going to support this and offer incentives. And then we expect other incentives to come along as well, in addition to the state incentives that are out there.
Great, thank you.
Thank you, Carlos. Any follow-up questions? All right, Jacqueline Opalak from Las Coast Outpost.
Thank you. So I've heard some concerns that as adults and children 12 or older are getting vaccinated, and as reopening is picking up, younger kids are kind of being potentially exposed more frequently without the same protections as their older family members. And I'm wondering if you think that those concerns about increased exposure for children is reasonable, and how can young kids be protected right now as families resume their lives?
It's a great question. The best way to protect them is to vaccinate everyone else in your family who's eligible. And that's what it comes down to. So if we have an unvaccinated family, you're putting your children at risk as well, because they can't yet get vaccinated. So that's our best protection. Continuing to mask obviously is another, really good one. And we're the masking requirements that are going to be in effect on June 15th, they're still going to recommend that people who are unvaccinated should be masking in many environments other than outdoors. What that's going to look like in reality, nobody's really sure, because there's not going to be anyone there checking at the door to see if you're vaccinated or not. But the recommendations are to, if you are unvaccinated, continue to mask, because you are exposing yourself and you're then exposing your children. So the children of vaccinated families are at very low risk though, because if those people are following the public health guidance, they're currently still wearing a mask in public because that's what's recommended until June 15th. They're limiting their interaction with unvaccinated people. Their kids are going to school with a mask on, which is very low risk. Their kids are not at high risk. So I think that the answer to the question though really lies in following the public health recommendations that are there, which are to get vaccinated and continue to wear a mask and follow the other guidance around gatherings and household mixing.
Thank you.
Thanks, Jacqueline. Any follow-up questions on protections for children who cannot yet be vaccinated? All right, Thad Greenson from the North Coast Journal joined us.
Yeah, thank you. I'm just curious if you guys have seen any movement in vaccine interest since the state announced the large incentive package last week. If there's been more interest in people getting vaccinated locally.
Dr. Hoffman, can you speak to that?
Sure. I think it's too early to tell. Honestly, I mean, the announcement was late last week. It was a holiday weekend. It was beautiful outside. I think that some of the numbers at some of our clinics are a little bit higher than I would have expected. I think that when we've seen other incentives like this announced in other states, it has increased interest. Again, the nationwide data around approaching everyone taking their mask off has seemed to incentivize some people as well. There's some data that just came out today around that. So I think next week, and honestly, the time to judge that will be come June 15th, when that incentive is over, or at least some of it's over. The larger things are over, because I don't know when those 2 million, when we're going to get to the 2 million people who are eligible for the $50. That might be before June 15th, or that could last longer. It's hard to say. So I would give it another week or two to really see where we're at with that incentive.
All right, thanks.
Any follow-up questions on the state's incentive program? All right, we have time for each reporter to ask one additional question. We'll start again with Isabella from the Times Standard.
Hey, thank you. So I had actually asked last week if public health had heard of any counterfeit vaccination cards being used in Humboldt, and Dr. Hoffman said no, that public health wasn't aware of it. So I guess first, has that changed in the last week? And secondly, how does public health plan to address what I would see as the inevitable issue of counterfeit vaccination cards being made, and also if there are any suggestions or guidance for business owners on how to make sure those cards are authentic if they are requiring them?
Have not heard of any counterfeit cards out there in Humboldt. I mean, I have heard reports of people trying to sell these things online. Certain, as you guys probably are all aware, some states have gone to a vaccine verification system. Some cities and counties have looked at that. The state of California is not looking at any sort of vaccine verification system. The things that we know are likely to be out there will be, employers needing to verify the vaccination status of their employees. That's still being worked out, what that's going to look like. I've mentioned the CARE database, California Immunization Registry, where everyone who is vaccinated in California should have their vaccine registered in that database. So there's CDPH is looking at a way to make a public-facing interface with that database so that people can get electronic access and not just have the card. Yeah, we'll see. I honestly don't think it's going to be a huge issue. There have been a few small studies that have looked at this, and the vast majority of people are not looking to, counterfeit this. And even in a situation, if there's self-attestation where people just state whether they're vaccinated or not, the majority of people will tell the truth and deal with the consequences of that, which could be for a while, meaning to wear a mask in an employment or an indoor environment that's not as controlled. And that's very similar to people in, say, a healthcare setting, clinic or a hospital during flu season. If they choose not to become vaccinated, they are required to wear a mask in that setting so that they don't, potentially spread influenza. So that's very likely to be a similar scenario with coronavirus, COVID-19, until it gets down to much, much lower levels.
Thank you.
Thanks, Isabella. Carlos from North Coast News.
Thank you. So previously it was stated that the age range between, I believe you said it was 18 to 39 is the group that it's having the most difficulty, at least according to the JIC. That's the group that's kind of the most resistant to getting the vaccine, the group that's not, really getting it as much. Has there been any additional efforts made to kind of target that group to get them to get the vaccine, since they're the largest percentage of unvaccinated people?
Well, I think that the incentive program we've been talking about, the Vax for the Win, is highly targeted at that group. What we know about that group is a lot of them are sort of ambivalent. They're not necessarily against getting vaccinated. They just need a reason to go get it. So again, that June 15th deadline looming to get a $1.5 million cash prize, hopefully it's going to motivate some folks. And even if you don't get a $1.5 million prize, you could still get a $50 gift certificate, which isn't too bad for a poke in the arm. So that's the sort of thing. The transportation issues as well. I'd encourage that group to go out and look on the vaccines.gov website and look at the transportation benefit that the White House program's offering to help people get to clinics, because I think that's also another thing that can be an issue is, that group doesn't have expendable funds to pay for gas to get to a clinic the next town over, but you might be able to use that transportation benefit. Or if you're my turn, there might be options there as well.
I just piggyback and say that's also why going to events around the community that often that age group might, frequent to make it easier if it's right there and it's accessible, so that there's no appointment needed, there's no driving needed. They just happen to be at an event where we're also providing vaccine is a great way to target that population too.
Thank you, Carlos. Jacqueline from Las Coast Outpost.
No more questions. Thank you.
Thank you. And Thad from the North Coast Journal.
Yeah, I have nothing further right now. Thank you.
Great. Thank you very much to all of our panelists and to our media representatives for joining us. We'll issue the recording as soon as possible. Have a great day.